My name is Stuart Goodman. I was born in Toronto and trained in Toronto both for my clinical career and my research career. Um, Came to Stanford and I'm a practicing orthopedic surgeon who specializes in joint reconstruction, juvenile arthritis, and osteonecrosis. And I have a lab. That's basically an internationally populated lab that does biomaterials, biocompatibility, tissue engineering, and cellular crosstalk work. I did my thesis in Lund, Sweden, which was absolutely terrific. I'd recommend people to travel the world and get educated across the world because whatever your country is, it's not the only way to view science, uh, but um, but there are lots of opportunities to travel and to learn, and that's what I'd recommend. When I was doing my residency at the University of Toronto, um, at the time, the first year of the residency was to do some clinical activities, such as work in a clinic a day a week, or take call, or be in the operating room for a day a week. But you did research, and it could be clinical research, it could be basic science research, it could be translational research, somewhere between the two. And that's when I really got into research. I mean, I dabbled some before during medical school, but because I made my mind up about orthopedics sort of in my last year, because I was interested in general surgery, um, I did much more during my first year and was enamored by the people who I was working with. I was a very lucky person. Well, there's the clinical aspects, and then there's the research aspects in the lab. So, and I do both. I still operate and teach and have administrative duties and do research. So for the clinical activities, I do mainly joint replacement. I'll do both primary and revisions, but I have a special interest in juvenile arthritis and also in osteonecrosis. And and I try and do my lab activities to complement a lot of my clinical practice. So, for example, because for many years I was doing a lot of revisions, redo hip replacements and knee replacements where there was a lot of bone loss, I had to learn a lot about materials. So that got my involvement with the Society for Biomaterials, and I learned a lot from a lot of colleagues there. But when you do revisions, you can only put in so much metal and plastic, and there's not much left. So then I got interested in tissue regeneration, in particular bone, some cartilage work too. And the bulk of my research now in the lab is looking at ways to improve bone healing, to improve cartilage regeneration, and to look at biocompatibility in biomaterials. So, um, with the clinical aspects now, we do a lot of outcome studies. So, I've been at Stanford for quite some time, and we have one of the oldest databases, so we can try and figure out which patients do better with what operations, with what demographics, etc., and try and correlate that with their clinical outcome. So we do a lot of outcome studies. And we also, for many years, and still do, take specimens with the patient's permission, of course, from our surgical revisions. And some of the early work I did was looking at why implants fail and the interface between bone and soft tissue and the implant. And so, as you know, I'm from Toronto. I was very, very affected by Dr. Victor Fernasier and Dr. Joe Schatzker. They had a very nice collaboration at the Wellesley Hospital. Dr. Fernasier was a pathologist, world renowned, and Dr. Schatzker was an orthopedic surgeon, world renowned. And they uh, helped enlist me to try and help them figure out all the characteristics of the interface between metals and plastics and wear debris, etc., and the human body. And that's how I got interested in not only the clinical aspects of total joint replacement, but also the successes and failures and correlate them with at first histology. And then when I came to Stanford, more sophisticated things like PCR and all the molecular and cellular analytic methods, and now we're doing a lot more advanced single cell studies. At the same time, my interest in osteonecrosis, which is the death of bone around the ends of hips and knees and other joints. We do a lot of tissue engineering work. We do a lot of work on cellular crosstalk, especially between immune cells and bone cells. And we have animal models, we have in vitro studies, and all sorts of things that people do here. And also, I'm very privileged to work with the people at the University of Pittsburgh and University of North Texas, where we have two NIH grants now on the joint on a chip, so tissue regeneration using microfluidics. And and we have published some papers on that and have ongoing experiments on not only how osteoarthritis occurs, but how to mitigate it and high drug throughput screening to try and treat that. So sounds like a lot, but I'm very lucky. I have a lot of great people who work in the lab and in other departments and some international, so to try and solve these problems. There are a lot of them. Uh, the first is making a decision as to what you want to do. For my specialty, um, in orthopedics, and it's true no matter where you are in the world, there's an emphasis on seeing patients and doing cases. And it's a fact of life now that medicine has become very complicated. It's become more corporate and it's become more high throughput, unfortunately. And so, as you know, if you don't, you'll find out soon enough that doing cases gets you a higher salary. It's all based on what you do. And if you want to do research, you have to come to grips with the fact that you're doing it because you love it. There's a lot of hurdles, there's a lot of obstacles. Some of your colleagues think that you're maybe not pulling your weight enough, but when they realize what you do and how important it is, and it's up to you to try and teach them, then they recognize it. But your salary's less, obviously. Finding an institution that respects research and respects the time that you'll need and the energy. Getting money is a huge hurdle, and it's become even harder now. Um, um, Years ago, people thought it was really hard, and it was hard. It's even harder now that more and more people are going into research, I think. And it's so interesting and competitive, and there are limits on money that can be derived from governments, from foundations, and from donations, basically. Um, and it's particularly hard in the United States now for a lot of different reasons you can imagine. Um, and then and then maintaining the relationships both in the lab with your collaborators, whether local, regional, national, or international, is really important. And so when you're a researcher, you don't only have to be focused and um, have specific aims and goals and stuff. You've got to be a psychologist, psychiatrist, because you're dealing with a lot of people with a lot of different personalities, and some more or less mature than others, if I can be so blunt. And sometimes people don't get along, and there are issues, and I always tell people I think they're going to send me as an ambassador to one of the countries to settle disputes someday after being in the lab for so long. I think I'm getting the hang of it now. But those are the main issues. Everyone's full of ideas. I'm telling you, I'm very lucky because these are not only my ideas, they're ideas of people all around me. It's going from idea to feasibility to fundraising to getting the team together to carrying it out to proving your hypothesis to having them lecture on it to getting it published to go to do it all over again. And you have to be a motivational speaker. Well, there's things going on now that I'm very excited about with regards to some of our models on osteonecrosis, some of our models using iPS cells, um, trying to figure out uh, all the intricacies about osteoarthritis. And, there are no drugs for osteoarthritis that prevent cartilage loss yet on the market. There are some good drugs for rheumatoid arthritis, but none for osteoarthritis. And hopefully finding some of those with hopefully the help of one of our grants and some collaborators. That's exciting. Finding out uses for iPS cells, iPSCs, is interesting. Uh, we'll see how that all turns out. It's almost too good to be true. Um, and trying to delve into the crosstalk and cellular interactions of musculoskeletal tissues with the immune system, and the differences between older and younger individuals. I think that'll be key. And I see patients from age probably 14 who have osteonecrosis or juvenile arthritis, all the way up to people over 90. And I think trying to take some of these principles um, from the bench to the bedside, to improve quality of life. Um, some people who are advanced in ages, in age, or even younger individuals don't have the quality of life that they imagined. And as an orthopedic surgeon, if we can give them a better quality of life with their own tissues, hopefully, like I'm happy to be put out of a job surgically to replace joints if we can somehow find the right recipe. So that's all exciting to me. So there's a few things I've learned along the way. Um, Number one, and I learned this from a lot of my colleagues in Sweden, because I did a sabbatical there and did my thesis there, is don't be afraid to take chances. I think Canadians are a little conservative, or were when I was growing up. Um, and I think that's great. Um, when I moved to Stanford in Silicon Valley, there's like it's startup city, and people take chances, and hopefully they don't go broke. Uh, but uh, but 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 if you're really committed and think something is going to work, and you can do something small to get you along the way, then take the chance. Don't be so conservative. Look at different avenues. That's one thing. And the other thing is, don't be afraid to fail. I have failed a lot. Every grant that comes back, every paper that comes back, it's like I tell people in the lab when they get a paper back, and let's say it says major revision, and they think, God, they're a total failure. I say, look, if you think that the editor is waiting by his or her mailbox to receive your paper and is disappointed every day that it doesn't come and then it comes, that's not how life is. Every journal gets hundreds, if not thousands. And there are lots of grant applications, good ones, that don't get funded. And you have to be persistent. I read a book recently that one of our orthopedic residents did grand rounds on, and it's called Grit, Grit. And it's very informative. She was a championship skier, this resident in the United States, then went into orthopedics. And it takes a lot of grit because experiments fail. I'm sure you know this too. Actually, I don't use the word fail. I say they don't succeed because you learn something from everything that doesn't succeed. And I don't view that as a failure because you learn and you get tougher and you rethink everything that you thought was true. You're constantly rethinking things. The other thing that I've learned, I mean, there's lots of things all of us learn along the way, is you always think that you're the first to do something, or the brightest person who thought about this and that. Chances are someone's thought of it before. If it's such a great idea, you're not the first. Someone's possibly even published it before. And but that doesn't mean that what you're doing isn't meaningful, or can't be meaningful, because there's variations. For example, a lot of the experiments done on mice or even rabbits used young mice and young rabbits, which is not the right age when you're looking at stuff that happens to older individuals. It's a different ball game. There's inflammaging and the immune system, and all the things that happen as you age. And the majority of drugs that seem to look pretty good in animals, rodents, whatever, they don't pan out, over 90% of them. And I think we take ourselves too seriously, and don't prove our point in different models to validate it and look at the data very critically. Well, I've been involved with the ORS for a long, long time, and I found it to be very inspirational for me. Seeing the leadership when I was a young buck, and then volunteering to be on a number of committees, um, and then being on the council, um, and doing a lot of work with JOR, being on the editorial board, and then representing the ORS to NIH, and then being on different committees, and trying to be a mentor at some point later on. Um, it really reinforced my opinion that the ORS is really integral, essential to anyone who wants to do credible research in the musculoskeletal discipline. And um, I found many people at the ORS, whether at our posters or their posters, or at talks or at social events very approachable. Um, um, they may not agree with everything that I think or they think, um, but um, but at least they're willing to listen. And so I should tell you that for my lab, I send them all to the ORS. So I'll send, I don't have a huge lab, but I'll send, 8 to 10 people to the ORS, not including myself or our lab director. Um, and I encourage them all to submit, and I encourage them all, whether it be an oral talk or a poster, to engage people there because they'll find that the world is a smaller place than they thought. There are people who are doing a lot of things um, that you're doing and can help you. Some of the best collaborations that I've formed have been at the ORS and continue to be like that. Um, it's also been a forum for me to the world. So, as you know, I think it's 4 years, there's a world meeting, and that's how I got to meet a lot of collaborators in Australia, in the Far East, in Europe, all over. So it's a springboard for someone's career. And then you visit their lab and they visit yours. Next thing you know, you've got postdocs from who knows where. So it's a must go to meeting. It's a must go to be involved. And I think in many ways, the more you give, you get a lot of reward. So I would strongly encourage that. And my one regret, I have to say, is that the ORS and the AAOS aren't back to back anymore because I think that was a great venue for crosstalk. The meetings used to be adjacent to one another, and some clinicians stayed over, um, or the ORS people stayed over for the AOS, and a few AOS people came early to see a lot of the papers at the ORS. And now it's hard to do. It's more expensive, but nonetheless, I think the ORS is still the premier institution of its kind in the world. I think I've mentioned to take more chances. Um, One thing I've learned to do is um, when you start out, you're so focused and you want to sort of close doors and try and get your own career going. And I think keeping the door open and listening to other people with regards to opportunities for collaboration or whatever. Um, Had I started that earlier, I think that would have been a good idea too. Um, and then I think, um, you know, the struggles for getting funding and getting space and going up the ladder, it's not easy here at Stanford. It's changed, but when I came to Stanford and you had to get tenure and it was do or die, and there weren't a lot of people in orthopedics who had tenure and not a lot of people in surgery. And I think being persistent and forming collaborations and less focus on yourself and what your goals are. I mean, it's important, but also listening to a lot of different opportunities, not getting too spread out because that can be deadly, but listening to other opportunities that may help you and how you can help other people. Um, I did a lot of clinical work when I started out, and because that's what was expected of me. I used to make rounds on my rabbits on Saturday morning, and then go make rounds on my patients. I used to change the coat, uh, but uh, but uh, getting the money and the help to realize your goals is always challenging. And if there's an easier way of doing it, uh, I don't think I found it. It was just a matter of grit and persistence and hard work, and I think it paid off in many ways. Well, if I didn't say getting married, boy, I'd be in big trouble because it is my wife's birthday today. Um, it was sort of bittersweet. Um, but one of them was getting tenure here. Um, it wasn't as sweet as I thought it would be because it was grueling. Um, I would think finishing orthopedics at Toronto at the time was very tough. Um, there were on either side of the year I was in, half of the people changed specialties, and it wasn't a pyramid system. And I think finishing it and doing my Royal College exams, um, and that was pretty grueling. Um, and then being an orthopedic surgeon, and then beginning a whole new career here at Stanford, getting your first job. I mean that's good, but it's every step is important, but I think those are the main things. I think probably the most gratifying, though, if I had really had to think of it, is um, that's personally, but seeing all the people who have worked with me and others become credible researchers, um, chairpersons all over the world, um, in China, in Japan, in Europe, in North America, to see them become essentially better than me in many ways, more successful. There's nothing that matches that, I suppose.